All right. Good afternoon, everyone. My name is Caitlin Jacob. I am the digital director at the Daily Advertiser and with USA Today Network Louisiana. We are very excited today to be joined for a coronavirus town hall. My name is Caitlin Jacob. I am the digital director at the Daily Advertiser and for a coronavirus town hall with US Senator Bill Cassidy, who is joining us here live. Thank you so much for joining us today, Senator.
Hey, Caitlin, very glad to be with you and with all the people who are on. Thank you. The important thing is to get information out. I thank the advertiser and the Gannett system for hosting this. This is our way to give you answers to questions you might have. And by the way, if I don't have the answer today, we'll post it on our website, which is cassidy.senate.gov. And I'm sure Gannett will post it on theirs because we'll give the same answers to them.
Absolutely. Thank you so much. So for any of our viewers and listeners who didn't know, you obviously have a kind of a unique approach to this coronavirus pandemic. In addition to being a U.S. Senator and dealing with it from the governmental side, you're a doctor.
Yeah, and I did a lot of public health. So in my resume, if you will, we started a vaccine program which vaccinated 36,000 children for hepatitis B. And so when you do that and write papers about it, you end up having a fuller understanding of the immunology of viral infections, how vaccines work, how our own natural immunity works. And I'm trying to use that kind of part of my experience to come up with a way, how can we get out of the medical crisis so then we can get out of the economic crisis? And that's the challenge, and that's what we're attempting to do.
Absolutely. So as a doctor, what about this virus has surprised you so far? And what's kind of the biggest unknown that's still out there that we're facing?
Well, I think it's what has surprised society. So let me people say, why is this different than the flu? We had 80,000 people die last year from the flu. Why is this different? So Caitlin, let me just go through that first.
Absolutely.
As long as each of us has been alive, we have encountered the flu virus either by a vaccine or by actually inhaling it and getting the flu. So much so that we have a whole library of immunologic response. So that when the flu virus comes in our system, our body looks through this library and says, this particular flu virus looks like this. They pull it off the shelf. They have that immunologic response that fights that virus and brings it down. That is different than the coronavirus. Okay. For this particular one. In the history of man's existence, 3 million years, our bodies have never, ever encountered the coronavirus, this particular version. So instead of having a library that we can open up and pull off the shelf to attack, instead, we're just a blank slate. And that coronavirus just pierces in and we have no protection. It's particularly true if you have certain risk factors. So now let's go back. 80,000 people died from the flu. Those 80,000 people typically would be very old or newborns. The newborn has never ever seen the flu before. And the very old, their immune system, their overall state is very weak. In the case of the coronavirus, yes, newborns are particularly at risk. Yes, the very old are particularly at risk, but so are other people, 30 and above, particularly those who have diabetes or high blood pressure or heart disease or lung disease or maybe cancer or some other immunologic problem. So it isn't just the very old or the newborn, it's a lot of people in between, and that is the issue right now in terms of the coronavirus, why it's different than the flu, why it's turned out to be more deadly.
Absolutely. So with all of that have you seen any myths or, inaccuracies that you see a lot of people talking about and spreading that you'd like to take a second to dispel right off the bat?
Oh my gosh, there's a lot out there.
Pick your favorite.
Yeah. One is that we don't have to worry about it. That if we just get together, have our crawfish boil, go to church, whatever, don't worry, it'll all be okay. And that might be particularly the people who are younger. Turns out if you're younger, you're less likely to have problems. So you saw the beaches in Florida filled with kids on spring break. And yes, it's true. Once you're out of the newborn stage, once you're about a year up to age 20 or 25, rarely are you going to have a deadly case. But you can spread it to other people. So you go home and you kiss your mother and your father and your daddy has diabetes, or you go and hug your mama and your pawpaw, they're the ones that die. So for the younger person who feels like, not going to bother me, well, it might not bother you, but you give it to another person. And the spread for every one person infected, on average, they infect 2.5 more people.
Mm-hmm.
And those 2.5 people infect 2.5 more. And those 2.5 more infect 2.5 more. And now you have a rate of infection that starts off slow and then shoots up like a rocket ship. So even the younger person who thinks that it's not going to bother them, they can spread the disease to others, and it can kill the person you spread it to.
Absolutely. So you specifically mentioned Florida, and there was a lot of talk about pictures of spring breakers out on the beach and people not at home, and they hadn't put in a statewide stay-at-home order until just in the last few days. So there are still several states that still don't have those stay-at-home. Do you think we should have some sort of national mandate as opposed to leaving it up to these states for these stay-at-home orders?
Well, a couple things. It kind of depends on how much disease you have in your state.
Mm-hmm.
So if you have a hot spot like Louisiana, stay at home. Montana apparently does not have very much coronavirus. So what you'd really like to do is institute the stay-at-home order when you know that your particular area of the country is going to be affected. Thank goodness for the cattle farmers in Montana who are still producing meat, who are still feeding us. Clearly, we need people working. So it would be wiser if you know it's hit your community in a big way. That's when you put the stay at home. And maybe when it's passed, you can relax a little bit earlier than another state where it's just starting to hit.
Definitely. And there's also been a lot of talk, particularly with Florida and Texas, for those of us here in Louisiana, where their governors have put restrictions on people from Louisiana who may travel to those states right now, not for work, but if someone chose to travel for personal reasons. So there's been a lot of talk about that, if they'll make you quarantine when you go to those states. Should Louisiana be restricting the travel of people into our state, particularly from areas where they do have those large populations like New York or Washington or anything like that?
I think any governor right now who is taking a large number of folks from an area which is a hot spot, if your state is not a hot spot, they should consider that. Governors are saying stay at home. So there was on Keel, I called into Keel, and Aaron says, well, what if I want to go to Buc-ee's in Texas? And I'm thinking, Aaron, what are you going to Buc-ee's for? I mean, I'm saying great toilets, but if you sit on it, you may get coronavirus. Don't go to Buc-ee's. And so the point being that we should be staying at home. And most folks should not be driving across to go to Buc-ee's or any other place. They should be staying at home. And if Governor John Bill Edwards decides that he needs to quarantine people coming from other states into our state to prevent more cases coming in, he's got that right. He's trying to protect our citizens.
Absolutely. Absolutely. So shifting a little bit. So the current models of the virus suggest that the peak of the impact may not be felt until mid to late April, with still us seeing some significant impact into May. Do you think these governors who are implementing these stay-at-home orders should be going ahead and pushing them further into May, maybe hoping people take this as seriously as they should be?
It depends.
Okay.
Let's imagine that everybody in Louisiana begin to take this seriously. As serious as it would mean that everybody stayed at home except for essential travel. And when you went to your grocery store or Costco or Walmart, you name it, you wore a mask. Mm-hmm. We would stop this virus in 14 days. Think about that. If we take seriously what Governor Edwards has said and what President Trump has said, I'm going to repeat this. Stay at home. When you go out, wear a mask, or at least keep 6 feet from other people. We would stop this in 14 days. It would no longer spread. At that point, we would not need to have the stay-at-home order into May or June or July. We would be through with this by April. Yes, there'll be an occasional case, but substantially through by April. So it's really incumbent upon us to stay at home, but also for the governor, and I know they are, to take into account how much people are complying with this. And they are complying. We can stop sooner. We still have problems. We need to keep it going.
Absolutely. Absolutely. So let's talk a little bit about testing. Particularly here in Louisiana, we've got some areas that have that are doing a lot of testing, particularly in our big urban centers. So in New Orleans, Baton Rouge, Lafayette, Shreveport. But we have a lot of our smaller rural parishes who may not be seeing enough testing. Are we doing enough here yet?
So first, the LSU Med School in Shreveport has extra capacity to do testing. So if your doctor or the hospital where you normally have in your community needs extra capacity, they've got capacity. And if you don't know how to reach them, log on to my website, cassidy.senate.gov, and I'll let you know. They've got a 24-hour turnaround time. So I just let some folks know in Baton Rouge, hey, listen, you can make it up I-49 in 3 or 4, maybe 5 hours on a bad. Hey, let's face it, you can speed today and get up there in 3 hours. And then you'll have your result 24 hours later. That's pretty good. So if you have a need for more testing in your community, I know from the dean of the LSU Shreveport Medical School, Dr. Ghali, they've got extra capacity. We will connect you with them to get those tests done.
That's fantastic, especially, because we are right now starting to see some surges from where the initial delay in the testing was leading to some of those surges in confirmed cases that we're seeing now.
Well, one thing I think we can say, hang on, my assistant is here, and so he's going to make sure that I got something here. One thing I think we can say is that some of the increased number of cases we're seeing may just be that we are expanding testing more. And people who formerly were not being diagnosed because there were no testing, now we're doing the testing. So now we're doing the testing, so we're starting to see some cases. But it does seem as if we're having an increase in the number of cases, which is why I go back to stay at home, sneeze into your sleeve, wash your hands, and keep 6 feet distant from another person. That's how we stop the spread.
Definitely. So I know you wrote an op-ed for the Wall Street Journal that was published earlier this week that talked a lot about your immunity registry and how that can continue to help get our economy going again and people back to work. Can you talk to me a little bit about that idea and what you wrote there?
We base this on immunization registries. When a child is vaccinated, it's been true since about 1996. When a child is vaccinated, the record of that vaccine is put into an online registry. So imagine a child is born in Beaumont, gets the first year of life vaccines, moves to Lake Charles, gets the rest of his vaccines or her vaccines for that first year of life, then moves to New Orleans or say Monroe, and in Monroe gets their 11-year-old vaccines, and then goes off to college in Shreveport at Centenary and gets a meningococcal vaccine at age 18. All these are put into this online database so that whenever that person graduates and goes to medical school, nursing school, joins the military, goes into law enforcement, they can pull their records off and show it to the dean of the med school or the whatever, or the military or the employer. I've been vaccinated. Here's my record all the way from Beaumont to Lake Charles to New Orleans to Monroe, now to Shreveport. Here's my records. It's all in one place. You have it. We've done that now for 30-something years, 25 years. So what I'm suggesting is that we do the same thing for immunity to the coronavirus. The best evidence is that once somebody has been exposed to coronavirus and has cleared the infection, that they might be immune. And the immunity will last at least for some time. Now, if that's the case, then you could go back to work. If it's a nurse taking care of a routine coronavirus patient, the nurse would not need to wear protective equipment. If it's a police officer, would not need to wear protective equipment. If you're in an employment situation, you wouldn't need 6 feet of distance. You could work next to each other. And if one of the two of you is immune, then you would not have to fear infection, or you would not have to fear being infected. So knowing if you're immune is a really important thing. So all these tests are being done all over. My idea is for a registry, and all these tests could come in, and just as you move around the country or the state, your records are staying with you. In this way, your record could stay with you, and wherever you were, you could pull it down, give it to your employer, and they'd know you're immune, and boom, then you get the job.
So how would this work for people who haven't been tested, haven't shown? So for instance, no one in my family has shown any symptoms of coronavirus and is practicing all the social distancing measures and everything. So therefore, none of us have been tested. So how would we know whether or not, maybe, because there's a lot of talk that if you had very mild symptoms, you may just never know that you had it.
Great question. We have to just expand testing.
Okay.
And so now people who have a little bit of a symptom, they should go get their nose swabbed to have the test. There's a blood test coming out that can show if somebody's been previously exposed. We can do that blood test and again, see if they've been previously exposed. And then we would be able to presumptively say that they were immune. So the key to all this is doing a heck of a lot more testing.
Great. So let's talk a little bit about what some of our healthcare workers here in Louisiana are facing. So obviously, as a doctor, you must sympathize with our healthcare workers who may be facing shortages of equipment, personal protective equipment, ventilators, anything else. What has this experience shown us about those resources that are available to healthcare workers?
Well, no one anticipated a pandemic, although perhaps we should have, but we need to have more of a backlog. I think it's clear that we have to bring some of the manufacturing that is in other countries back to the United States. I'm not blaming other countries, but if you're India and you decide that, we may need this medicine, so we're not going to let it be shipped to the United States, guess what we've just decided? We need to be making our own medicines in the United States, not reliant upon another country that may shut down our supply. And when China stopped the export of the mask that we need, even though it was an American company making the mask over there, maybe we should make those masks here. We might pay just a little bit more, but that way we know we're secure. As it is now, it is clear we are not secure with our manufacturing being moved overseas.
Definitely. So when can Louisiana start to see some of those additional ventilators and PPE that I know the governor's working hard to request?
Everybody has been, when I say everybody, states across the country have been trying to get these. I know we received 150 a couple of days ago ventilators, and I think like 150 a few days before that. So we are trying to get supplied. There's a lot of internal sources that we're trying to use. If you think about a physician-owned hospital or an ambulatory surgical center, typically they do elective cases. Elective cases have been shut down, so those ventilators are being transferred to hospitals to care for patients. I happen to know some hospitals, Ochsner, for example, was able to buy some additional ventilators. Between it all, we're trying to get to the point where we can meet this surge. The governor still says we might be out of ventilators by next week. I'm going to go back to what I said earlier, Caitlin. Each of us has the ability to stop this epidemic if we sneeze into our sleeve, wash our hands, keep our distance, and stay at home, except for essential travel. If you have to go out, wear a mask. If we do that, there'll still be a rise of cases, but it will then begin to fall. It is up to you and me, all of us. We are in it together.
Definitely. And we hope, just reminding everybody at home, making sure you are practicing those good social distancing measures and washing your hands and all of that great advice. So when we asked our readers about questions that they wanted us to bring to you, we got a lot of questions, understandably, about the economic stimulus package that was passed. So first, do you think that, the total on it's a $2 trillion stimulus package? Do you think that's enough to help get our country through this?
We'll see. Tell me how long it lasts.
I wish.
Tell me how effectively people socially distance or stay at home. I mean, it really comes down to that.
Mm-hmm.
If it turns out that 8 to 12 weeks is enough, we probably have enough. If it turns out no, it's just that Americans just won't listen to the president and to their governors, and it continues to stretch out, we'll probably need more. I will say two things. I do think there may end up being more money for the small businesses may be required no matter what. Secondly, I am advocating, and now I see the president has also thought this is a good idea. I'm advocating for a large stimulus package, not a stimulus package, infrastructure package. Infrastructure, bridges, roads. This would be different than President Obama's. President Obama's, it had to be shovel ready, which meant that if you were a small town, you probably didn't have a plan on the shelf, you got left out. And if you did have a plan on your shelf, it may not have even been the best plan, but because it was so-called shovel ready, it got funded even though it was not the best plan. In my opinion, it should be something like $200 billion a year for the next 8 years. And we can borrow money now at 0% interest rate. If you can borrow money at 0% interest rate, that's not bad. And then we can borrow the money to put working Americans back to work in construction, which would then pull through manufacturing, stimulate the service industry, but also stimulate oil and gas, because of course, if you're doing construction, you have to buy a lot of gasoline and use plastics and other natural gas products. And so it's a way to keep this economy working for those who are most vulnerable, for the working families. And that is the core of Louisiana's economy. And by the way, if you build a bridge, it also helps you down, excuse the pun, down the road, because down the road, you've now made your transportation so much more efficient that efficiency benefits for generations.
Definitely, and that trickle-down effect, we can see how that works. So when can people start expecting their stimulus checks? That's the big question everybody's asking right now.
So Secretary Mnuchin says the first checks will go out within 3 weeks, and there'll be several kind of boom, boom, boom. Those who get it first will be those folks who file taxes online and get their refunds directly deposited to their bank account. That is the easiest group to get the money out to. The second easiest group are those who are already getting Social Security checks. This will go to them because they already have their address. The hardest group will be the folks who have not been receiving Social Security, but did not pay taxes or did not file an income tax return in 2019 or 2018. The government doesn't know you exist. So they're going to, on the IRS website, they're going to put up some information where you can log on. You can amend your return from 2019. You put in your name, your Social Security number, your address, and then you put your income as a 0, but they now know you exist and you can get one of these checks. That will be a little bit later, but it will come. So it will come, and that's a good thing. By the way, my assistant just handed me a note. The state is receiving 103 more ventilators today, if you will, kind of throwing them into the gap. And so that's a good thing. We need more, but at least we have a few more to get us through to push back that deadline when we don't have enough.
That's great to hear. So we have time for about one more question before our time is up here. So one question we got from a reader was looked at, we've talked a lot about the social ways to prevent the spread, social distancing, washing your hands, etc. But there are some of these essential businesses that are open that people kind of do tend to congregate in. The grocery store is a great example. When you go to your weekly shop, you're going to be around other people. So what are some further measures while we're out taking care of some of those essential functions that we can continue to stop the spread? Should everybody using hand sanitizer? Should we be placing limits maybe on the number of people allowed in the grocery store at one time? Anything like that?
Wear a scarf. And if you don't have a physician's mask or a surgical mask, just get a bandana. And if you have to be closer to people, you'll look pretty cool. You'll kind of look like a cowboy back in the John Wayne days. Carry your hand sanitizer in your pocket. And so as you encounter things, go ahead and after you kind of take things off the shelf, wash your hands. You may even want to do, and what I do, I put my Clorox wipes in a baggie. And then when I pick up, when I use a cart to put my groceries in, I wipe off the handle. Somebody tells me, and it makes sense, he makes sure that he gets a cart that has been baking in the sun. He figures that the heat is more likely to kill any viruses that are on there, but that does not substitute for using your Clorox wipe. And then following that, when you're through with everything, with the hand sanitizer that you got put in your pocket. So, and of course, when you're in there, even if you're wearing a scarf, if you have to cough or sneeze, do that. We got to be around folks at some point. And I don't know for a big store if you could actually, okay, you come now, you come now, you come now. But we can do those things I just discussed. If you do those, you'll protect yourself.
Fantastic. Well, we are just about out of time here. Do you have anything else you want to share with our viewers before we sign off?
If you go to our website, cassidy.senate.gov, yeah, I got that. If you go to our website, cassidy.senate.gov, there's a banner ad at the top in red. Click on it. It will take you to information regarding the CARES Act that we put out to address the coronavirus crisis. It has things about the checks coming to individuals, things for the small business folks, forms that you need to fill out in order to access it. We're trying to get information up in Spanish and Vietnamese as well. By the way, churches qualify. So if a pastor is watching for this, and 501c3s. So if you're a food bank, you can qualify for these small business administration loans. But go to our website. Our Twitter account is at Sen, SEN, Bill Cassidy, at facebook.com, as in Senator Bill Cassidy. And our Facebook page is US Senator Bill Cassidy. Follow us on social media. We're trying to push information out. Let us know your concerns. We're here to serve you.
Fantastic. Well, I want to thank you, Senator, for taking some time to answer some of our readers' questions today. We really appreciate it.
Thank you, Caitlin, very much. And thanks to the readers. Be safe. Keep your joy.